Adjustment of the acrylic if you're trying to retract upper incisors. As you expand the arch, the labial bow will retract, but you have to make sure that there's a clearance of acrylic to allow the teeth to retract. Basically, you take a lab burr, take it to the anterior section, reduce the size of the acrylic to allow the centrals to retract. After you reduce the acrylic, you can come with a polishing burr, smooth the acrylic down, and after you've smoothed the acrylic down, it will be comfortable for the patient and will allow the labial bow to retract. As you expand, the bow will retract, or you can place your bow activation to retract the upper incisors. Then as you relieve the acrylic, you have to leave about a millimeter clearance. Usually you don't want to take more than a millimeter, because if you take the acrylic too far back, sometimes the tissue will swell and drop back between the teeth and the acrylic and cause irritation. So just usually a millimeter to 2 millimeters clearance of the acrylic when you're retracting incisors. You can also use the acrylic to get rotations out of posterior teeth as well. You can relieve the acrylic on the part of the tooth that you do not want to move facially. For example, this tooth is rotated a little bit distal lingual. You keep the contact with the acrylic on the distal, take the acrylic out of contact on the mesial, and as you develop, it will start to derotate the bicuspid. You can utilize this acrylic adjustment anywhere within the orthopedic appliance to gain rotations to help make your straight wire easier.